Welcome to the Longevity Optimization Podcast, where we discuss longevity, optimal health, nutrition, peak performance, cognitive excellence, and so much more. Dr. Scott, it is such a pleasure to have you here with me today.
I love being here, Kayla. You have a beautiful house, and it's just so great to be in person to have podcasts. I don't get to do this often. So.
I know. It's such a pleasure.
Yeah.
Well, we've obviously known each other for years,
Yep.
but today we're going to be doing like a deep dive masterclass on hyperbaric oxygen therapy. Everyone that listens to this probably knows that I just got a hyperbaric chamber from, the company that you're with,
Yep.
one of the companies you're with, One Base. And then we're going to be talking about methylene blue. So would you just give a little bit of background for the listeners? How did you
Sure.
become so interested in hyperbaric medicine?
Sure. So I grew up the son of a chiropractor and very out of the box. And so when I went to medical school, which was actually kind of crazy, given that my dad was a chiropractor at the time, he actually encouraged me to go to medical school because his sense and my sense at the same time is that, chiropractors were limited in their scope. And so that if I became a medical doc, I could do anything I want, in quotes. But now we know that you're in a much better position not having a license than I am having a license and being a medical doc. But throughout my training in medical school, I learned a lot of different things. And I actually really liked a lot of things that I learned. But I always kind of want to bridge this chasm between that conventional world that I was getting trained in and also the unconventional world that I grew up in. And funny enough, I found hyperbaric therapy in the basement of a trauma center. And they were using it for terrible wounds, for infections, for carbon monoxide poisoning. And I was seeing these amazing things happen to these people that were down in this basement, gigantic hyperbaric chamber. And I was really tired at the time. I remember I was like, it was every 3 nights I was on call for 30 hours. So they don't do that anymore.
Jeez,
but it was crazy.
Good thing.
Yeah, but this is before that. The rules for residents have changed a lot over the years, but I was at the point where they're doing 30-hour calls. So you're doing 30 hours every 4 nights, in the hospital. So you were just a zombie, basically, And so in the trauma center, you were every 3 nights, 40-hour call, 30-hour call. It was crazy. But so I was very tired, but I remember thinking, wow, this is amazing. So I did my own research afterwards, and I saw that they were using hyperbaric therapy for all these different things across the world for people with strokes and traumatic brain injuries and severe infections, trauma, dementia, so many different things. And so over the decade or so that followed, I really created my own practice around hyperbaric medicine. And I really wanted to take an integrative approach, as you can imagine. So I grew up the son of a chiropractor. So I was always like, well, how am I going to throw this in more of an integrative context? And so over the years, I kind of created my own framework on how to think about hyperbaric medicine, not just, going into the chamber. What are you doing before, during, and after hyperbaric medicine, hyperbaric therapy, to really try to leverage the technology, or in the reverse, trying to make your goals happen faster by using the technology, using other technologies as well. So that's the framework that I created, and that's kind of what I do now. So I've been over the last decade or so. I used to be the director of multiple different programs around the Northern California area when I lived there. Now I live in Colorado. I do a lot of consulting, both individuals to individuals that are interested in hyperbaric therapy, along with clinics all over the world, helping them integrate hyperbaric therapy with all these other modalities that you're so knowledgeable about, but how you can leverage other tech, tools, supplements, technologies, and bring it all together for people in a really comprehensive way. And it's a fantastic technology that really have a lot of, it has a lot of impact in so many people in so many different realms of their world and their life.
I love that.
Yeah.
Well, yeah, I definitely have texted you some questions because we have an HBOT at my clinic. So I've been like, oh, Dr. Scott, what should I do with, this person?
Yeah.
So, I love that, but it's so niche. So, I love talking to people with like such a niche understanding, deep understanding of a topic. So you mentioned that hyperbaric, was in this hospital, right?
Yeah.
So I feel like people think that hyperbaric oxygen therapy is new or novel. But tell us a little bit about the history.
No, it's been around forever. Actually, back in the 1600s was actually when the first device that kind of looked like a hyperbaric chamber was actually developed. Wow. It didn't become a medical technology until the early 1900s, 1920s or so. It was actually, the history of it is when they were building bridges, like the Brooklyn Bridge in the United States and New York, in Brooklyn, obviously. They found that these people that were underneath the surface of the water digging in these bridges, that they came up to the surface too fast, they get these terrible injuries that they call the bends. otherwise known now as decompression illness. And so they found that if they went back into these little, called these caissons, these areas underneath the water that they were actually sunk down in to dig the bottom of the ground where the bridge was going to go in, that their symptoms would go away. So they wanted to simulate that in a chamber that you didn't have to go under the water to go into. And that's when hyperbaric therapy really became the first medical reason to go in was for decompression illness or for the bends. So if you're diving now, if you go to Thailand or you go to the Great Barrier Reef or all these places around the world, you always find these hyperbaric chambers there as a rescue if you get the bends, which it can be pretty terrible, right? The bends, really what that is mechanically is that you get these bubbles of nitrogen that build up in the system that actually come out of circulation and block circulation. And as a result of these bubbles coming out, you can't get blood flow like to your brain, to your spinal cord. The most common areas are spinal cord and the brain. So you get people that would have paraplegia, quadriplegia, it look like strokes as well. It can be pretty nasty. And so that's really the first medical use of hyperbaric therapy. But over the last 100 years or so now, we now know that it has multiple different indications because of how it works, from a base physiology perspective, which I can, go into if you'd like.
Yeah, I would love that. Yeah. The mechanisms of how hyperbaric works. Yeah,
so the way I like to describe it, it's pretty simple, right? So in a hyperbaric chamber, we're doing two things. We're increasing the amount of oxygen you breathe, and we're increasing the amount of pressure that your body's under. So we all know about oxygen. Oxygen is kind of important. It's why we breathe, because oxygen is the final part that's required for us to make energy, or ATP. So the fancy way of saying this is it's the final electron acceptor on the electron transport chain in your mitochondria, which many of your listeners know all about, I'm sure. So if we don't have oxygen, we don't do very well for a very long period of time. For most of us, it's not going to take long for us to feel the bad effects of not getting oxygen. So, so what do we do here? So red blood cells are what carry oxygen in the system. So red blood cells carry oxygen from our lungs to the rest of our body and help deliver it to the rest of our tissue. So we typically have an oxygen carrying capacity. The amount of oxygen that we can carry is dependent on how many red blood cells that we have. So how can we increase our oxygen carrying capacity? Well, you can come visit me in Colorado, and I'm at 5,000 feet. The oxygen levels there are 16% in the air compared to being at sea level, which they're 21%. So for people wondering what the rest of the air is, it's mostly nitrogen. If you live in a big city, Los Angeles, or you live in New York, you're going to get other kinds of unfortunate gases like carbon monoxide that are in the air too. But in general, it's mostly nitrogen, and you have 21% oxygen at sea level. And then if you come to visit me in Colorado, it's about 16% oxygen. And so what happens when you have less oxygen in the air is that your body has a hormone that it releases called epogen. Epogen is EPO for short. People have heard of EPO because it's also a drug that people use exogenously, or they take to increase the number of red blood cells they have in circulation. So Lance Armstrong is the best example here. He was caught doping. Doping is actually using epogen. So, but when you use epogen, you increase the number of red blood cells in circulation. And so that's increasing your oxygen carrying capacity. So usually your oxygen carrying capacity is dependent on how many red blood cells you have, right? So you can increase the number by increasing that hormone, that epogen. You can also give yourself a transfusion of red blood cells, which has also been known to happen for people that are doing performance kinds of races. When they do that, you're also increasing your oxygen carrying capacity. The only other way to increase the oxygen carrying capacity is not on your red blood cells, but actually to increase the amount of oxygen in the plasma, or the liquid of your bloodstream. The liquid of your bloodstream has very little oxygen in it at sea level, but if you increase atmospheric pressure, you can drive up to 1,200% more oxygen in circulation. And so what is pressure? Okay, pressure is a simulated feeling of heaviness that we give you in a hyperbaric chamber that simulates the amount of pressure you would feel under a certain amount of seawater. So if you're swimming in the ocean and you dive 10 feet or 15 feet below the ocean, all that water above you is exerting a significant amount of pressure on you because it's extremely heavy. You don't feel it though, because you're, the density of water and the density of you, but that water is extremely heavy. If you pick up a bucket of water, you know how heavy a bucket of water can be. And so it's that heaviness that we simulate. And so that heaviness allows you to change the physiology, just physics here, to drive more oxygen into the liquid of your bloodstream. And that is a huge amount of additional potential when you have all that oxygen in there. And that's the power of hyperbaric therapy, is that you have all that oxygen in there with all that pressure. Now you're going to create all these immediate changes when you're in the chamber, and all these long-term benefits of being in the chamber over a protocol, for example.
Wonderful. I've heard that the air, I don't know how long ago this was, used to be like 60% oxygen. Do you know anything about that?
So there have been periods of time in evolution where there has been more oxygen in the air that we're breathing now, and more carbon dioxide too. And so as a result of that, has changed over many, many millennia, depending on the time of year or the time of the epoch that it was happening. But in general, we think that when the dinosaurs were around, for example, that there was actually more oxygen in the air at that time. And that's why there was more larger life, and also not only just animals, but also plants as well. So, because if there's more oxygen, there's also gonna be more carbon dioxide. It kind of goes together, right? Because again, most people know this, but the more oxygen that we have, so the waste product for plants, they breathe in carbon dioxide and make oxygen, right? And then we obviously breathe out carbon dioxide amongst other things as well. So, but yes, there's been lots of variations, and there's actually a lot of controversy as to how much oxygen has been in the air at various times, because there has been consideration that too much oxygen could be bad for us, actually. And this is actually an interesting segue into kind of how hyperbaric therapy works, because when we're increasing the amount of oxygen in circulation, we're doing a couple of things like immediately, right? The first thing is that we're increasing the amount of obviously oxygen in circulation. So what does that mean? If you've had like an acute heart attack, acute stroke, acute traumatic brain injury, spinal cord injury, there are good studies that show that hyperbaric therapy can save tissue if you can get into the chamber fast enough, because you're reversing those low oxygen states, right? So immediately. So that's amazing. The other thing that's happening in the chamber is that you're creating more oxidative stress in the system. So people get worried about oxidative stress, but oxidative stress is created when you have more oxygen around, you have more of these free radicals. What the body does is respond to those radicals by creating and increase the amount of stem cells that are released from your bone marrow and from other locations. And stem cells are the ones that help us make new tissue, that can regenerate tissue, etc. You also decrease inflammation by doing this as well. You create a stimulus of what's called an epigenetic stress. So epigenetics is the study of how expression of genes changes depending on various types of environmental factors. In this case, oxygen is causing an oxidative stress and causing epigenetic changes that increase growth, decrease inflammation, prevent programmed cell death, and a number of other things at the same time. So we all know that exercise causes oxidative stress. It's like hormesis, right? It's an oxidative load that should be beneficial, which is absolutely true in a hyperbaric chamber as well. Of course, if you're not ready for hyperbaric therapy, for example, if you're significantly inflamed, if you have a lot of oxidative stress ongoing, if you're not addressing some of those foundational things, then you may not be appropriate actually to go in the chamber right away. And that gets me in trouble a lot in the hyperbaric world. And I think this, Kayla, is that I tend to say it's not if hyperbaric therapy would be helpful, it's when. And it may not be right now that it's best for you, especially if you have more of a chronic issue that may take some more foundational support before going in and getting into a chamber overall.
That's very important. And yeah, I agree. Let's talk about, real quick, I have a question. So if you had one of these acute conditions and you say you want to get into the chamber immediately,
go to the hospital first.
I was going to say, obviously, you're
go
going
to
to
the
the hospital
first,
right?
Please.
Not like continue having a heart attack in the chamber.
Although I know some hyperbaric doctors that have done this, I do not recommend anybody go into a hyperbaric chamber before going to the hospital if they're having an acute event. Yes.
So then as soon as you would get home or as soon as you would have access. So, the most
the sooner the better. Yeah.
But if you have a concussion or something, I mean, yes, you should still go to the hospital, but I feel like a lot of people don't because they don't even know if they really had a concussion.
Right.
If you bonked your head, would you recommend going in like as soon as you can?
Yeah. I mean, I have a chamber at my house for this reason, because I have young kids, and I have one who plays soccer all the time, and she's always getting bonked around. She's 12 and hasn't kind of grown as fast as the other 12 and 13-year-olds that she's playing with, and she plays defender, and she's tough, but she gets knocked around. So I always have her going in the chamber with me. And so, I mean, certainly if it's concerning, you should go to the hospital.
Yeah.
But what's happening with concussion or any of these acute injuries is that you're going to have at least mild amounts of low oxygen in some areas of your brain or some other location. So hyperbaric therapy can be a fantastic way to reoxygenate the system very, very fast. And so, yes, I absolutely use it for acute things, but the protocols are usually after being stabilized or being evaluated by somebody that's like in a hospital, urgent care, that kind of thing. So,
absolutely.
Yeah.
The first time I ever heard about hyperbaric was actually when I was doing the coursework through the Amen clinics.
Yeah.
So, I mean, I was just amazed. And obviously, in terms of neurological conditions and brain health, it's like one of the first things that Dr. Amen would always recommend. So I love that.
Yeah, and I've known Daniel's work for a long time, and he's one of the first people that really got was really a huge proponent for using hyperbaric therapy, and he got some chambers in his clinics and was helping people get them. And I was actually involved very early on with all of that. And it's, again, the brain is a very important part of real estate that we have, and every section, every nanometer is important. So as much as we can save if you've had an acute issue, the better. And but people don't have to be, it doesn't just have to be acute things. We can see significant benefits in people that have had chronic injuries for even years at a time. Certainly the faster you get into a chamber, the better. But oftentimes if somebody has more of a chronic issue, this is where I'm like, well, maybe it's not the exact time to get in right now. Like say if you had a concussion for 6 months, and it may not be the right time to go in without looking at optimizing your foundational health, your vitamins, your minerals, your nutrients, your antioxidant status, like your behaviors, your lifestyles. Like I always tell people, if you want to get better, stop drinking alcohol every night and go into McDonald's 3 times a week, right? Otherwise, whatever I'm going to do in the chamber to help you is going to go away, or you're not going to see the benefits over the long term. So.
Yeah, I mean, absolutely. People are often, I have all these amazing things at my home, which is, it's an anomaly, right? Even a lot of people don't have these things, but I think it'll become more common. But I can't just think to go in on PEMF for the chamber and then have, horrible lifestyle. Obviously, I've first step. I mean, I've been, living this way since I was 18 years old, and it's got progressively more intense. But if you're not eating right and sleeping right, those are the things that move the levers the most and impact health and lifespan. So again, we always have to say that because
I just have to try to emphasize it too. Like if you have an acute issue, like an acute trauma, then I always say do not pass go. Find, get stabilized, and then I think many of the times hyperbaric therapy is going to be very, very helpful. If you can arrange and get into one or find one, and it's affordable to you, then it's going to absolutely help with your healing. But if you have a chronic issue, then that's where things are more nuanced. And that's what I've developed over the last decade or so, is more of a foundational framework to think about, okay, somebody's coming in with 6 months of whatever it might be. Let's say they have migraines. That's a really great example because a lot of people have migraines, or they have they have long COVID, for example, when they've had this for 2 years. And if they're not looking at addressing some of these other pieces here, then I've just seen that people don't get as well as I'm anticipating that they would. And in the beginning, when I first started doing hyperbaric medicine, I think 2013, I was getting burned actually in the beginning because I was like, well, people should be getting better. Why aren't they? And then I realized that no, they didn't have the capacity to take all that energy that we just put in the system and put it to good use because they didn't have the capacity to create their own response to that oxidative load that was coming in. And that's when I started supporting them with things like that would help them make energy better. Maybe it was just a B complex vitamin. Maybe it was something like, methylene blue, which we'll talk about later, or it was just, do they have enough antioxidants in their system to neutralize all that stress that we just put in because of being in a chamber?
Yeah.
Those are things that most hyperbaric clinicians aren't thinking about. And that's where, there's not many of us in general.
I was going to say, it's not like they're just running amok here.
But in general, if you go to a hyperbaric facility, and I have a lot of friends that run these places, if you run a facility, you want people to go into your chambers, right? And just like if you go to a heart doctor, they want to do an EKG and an echocardiogram. It's just, what people do, right? So, for you and I, which is kind of nice, we have more of a 30,000 foot view and say, these are things that can be really helpful, but in the context of when is it appropriate for you, right? And that's the context of, if you have something that's long-term, that's been ongoing for a while, then I can promise you that hyperbaric therapy could be helpful, like a half promise. But it may even be better if we can do some other things to support the system along the way so that you're truly going to leverage your time and your effort. Because as you know, going to a hyperbaric chamber is a lot of time, it's effort, and it does cost money. So we want to make sure that we're making sure that it's the time and the place and everything's going to be as optimal as possible so you can get the most benefit possible.
I love that. Let's talk about some of the, conditions. You can talk about the ones that, of course are co-signed by the FDA, I suppose. And then let's just talk about some of the research around some of the other conditions, because obviously, I'm using this for longevity. There's been some really interesting studies out of Israel related to lengthening the telomere. So I'd love to go into that, but I know, fertility, autoimmune, just what is the data telling us that might be possible with hyperbaric?
Yeah. So there are 14 indications that are covered by insurance in the United States. 4 of those or 5 of those are really available outside of an acute trauma center like I was at training in medical school. Those 4 are diabetic foot ulcers, radiation injury from radiation treatment from cancer therapy, sudden hearing loss, if you have, it's a very specific type of sudden hearing loss that's called a neurologic presentation, or somebody might just wake up without hearing one day. Very, very sensitive, uncommon, but it can be pretty devastating to people, obviously.
Yeah.
And then there's also another one, chronic flaps and grafts. So if you're going to get plastic surgery and you have a plastic surgery on your face or on your breast, if you're getting breast reconstruction after like a mastectomy, for example, for breast cancer, sometimes those flaps won't work and they won't stay on, or they won't actually take, and you can use hyperbaric therapy to make sure that those actually work better. So in the end, what hyperbaric therapy really is it's a wound healer. It heals things from the inside out, and it does this in a number of different ways. I was kind of alluding to this, but this will help with when we talk about some of the other indications. So number one, it reverses low oxygen state. It does that immediately by increasing the amount of oxygen circulation. But over the long term, it actually creates new blood vessels and tissue to help regenerate, revitalize, and optimize that tissue over the long term.
Question about oxygen saturation.
Yeah.
So I think a lot of people are wearing Oura rings now, right?
Sure.
So it has your oxygen saturation, presented to you every day.
Yep.
What if someone sees that they have low oxygen? Would they want to find a chamber soon, or what are things that they can do?
It depends on why they have a low oxygen level. So you make a really good point, though, is that like a pulse oximeter, which is what you measure your oxygen levels, that's measuring how many sites on your red blood cells are actually bound with oxygen. So most of us should have a sat somewhere between 96 and 100%. So if you go into a hyperbaric chamber, we're going to be saturating any of those sites that aren't bound, which is not that much. 96% to 100% are already going to be bound even here at sea level, right? And that's only 21% oxygen in the air. In a hyperbaric chamber, as we were describing earlier, you're actually saturating the plasma. So you don't get a good read of that by using a pulse ox. So it's not like you can use a pulse ox. Although I will say in the beginning we're kind of the middle of the pandemic, when we had a lot of people coming in for pulmonary focused long COVID or symptomatic low oxygen levels after COVID infections, I would see their oxygen levels around 88 to 91%. And after like 3 sessions, their oxygen sat would go up to like 97%, and they would just feel so much better. And then it would just stay there, which was amazing. Yeah. So I still see that now, although, we don't see that as much because we don't see as much pulmonary COVID as we used to. Like long COVID, most of it's more neurologic or more systemic in other ways. But in the end, if you have a low oxygen level, like it just depends on why, if it's really specifically related to something that that's easily reversible. Like for example, if you're coming to visit me in Colorado again, we can get you in a hyperbaric chamber and we can see your oxygen level go from a maybe 90, 91% when you first get there to 96 and 97%, and then stay that level for at least 3 to 5 hours afterwards, which is super cool because the oxygen that you circulate or that you saturate in the system stays in circulation for about 30 minutes, but then the ability to utilize oxygen actually goes up and stays up for about 24 hours under most circumstances. So you'll find if you start trying this, that if you go into the chamber and you start exercising, that you're going to reach your anaerobic threshold later. Like you're going to have more capacity for longer because you have more oxygen utilization for longer as well. Then you could add things like methylene blue, which is even more fun. But to go back to what I was mentioning, so you have hyperbaric therapy's base physiology is it reverses low oxygen states, as we were describing. So that does it initially by flooding the system with oxygen, and over the long term by increasing the amount of increasing the amount of blood vessels in circulation to angiogenesis. That's it. Number 2, it decreases inflammation. It does that immediately, and it also does it over the long term by downregulating a bunch of the things that cause inflammation, like interleukins and TNF alpha and these other kind of cytokines that can cause inflammation. So it does that. The third thing it does is it releases stem cells. We mentioned that earlier. So exponential release of stem cells. Okay. The fourth thing it does is it revs up your immune system. So it helps with the whole process of wound healing. So bringing cells to the area that need to clean up tissue like macrophages and neutrophils, and then also preventing scarring and fibrosis over the long term as well. It's also increasing the amount of lymphatic flow as well. So you're getting more detoxification capacity because of the pressure in the system. So with all of those things being said, most of the conditions out there that we know, of course, have one of those components that would likely be beneficial to go into a chamber, right? So, but from a research perspective, where have we seen most of the research? So a lot of research in traumatic brain injury, so concussion, both acute concussion, but especially chronic concussions. People that have concussion 3 months or longer can see significant benefit. In patients with stroke, significant benefits in stroke immediately is going to be best if you can, but even 3 months to 3 years, there's been some good studies out of Israel showing that you have great capacity to reverse people's stroke symptoms, not only their cognitive symptoms, but also their motor symptoms, and reverse a lot of that. But the sooner the better. Okay.
Yeah.
So there's also with multiple other things, including surgeries. So in performance. So like if you get a surgery, you're creating a wound in the body, right? And that's whether you get a plastic surgery or you have an ACL tear or whatever it might be. So what hyperbaric therapy can do is it can actually improve healing rates about 30 to 70%. So I worked with tons of athletes over the years as a way to get them back on the field faster. But even if you're not an elite athlete, of course, nobody wants to have raccoon eyes for 2 weeks. You can have it for 1 week after your plastic surgery.
Yeah.
So over the years, I've worked with lots of plastic surgeons that have referred our patients or their patients over to hyperbaric facilities that I've worked at. So from a surgical perspective, any kind of surgery is going to heal faster using hyperbaric therapy if you can get in the chamber. Typically you get in the chamber a couple days before if you can, and then after the surgery as well if you can. That's kind of the protocol that we would use. So we're also using hyperbaric therapy in oncology a lot now as a synergistic tool in lots of different ways, as a way that sensitizes tumors to radiation, to chemotherapy, in combination with other oxidative therapies like IV vitamin C, working with integrative oncologists in real significant detail. It also can improve significant quality of life in those patients with anemia, because if you have low oxygen levels, because of you're anemic, you don't have enough red blood cells around, then you can't carry enough oxygen. And so we can remedy that as well. So
could hyperbaric like help almost reverse anemia or
it doesn't reverse anemia, but it can help temporize and make people feel better if they're getting into a chamber while they're anemic. Because again, you can't get enough oxygen to your tissues because you don't have enough red blood cells.
Yeah.
And so as a result, you don't feel well. And so this is all related to, it could be fatigue of the brain, it could be exercise-induced fatigue, it could just be concentration problems, it can be a lot of different things, right? But what we find is that people with anemia, they get into the chamber, they feel so much better because all of a sudden they have enough oxygen to play with finally again. So yeah.
Love
Yeah.
that.
And there's a lot of other indications as well. But what it comes down to for me is that I always think about that base physiology, low oxygen levels, inflammation, stem cells, immune system activation, and lymphatic flow. And then there's all these studies that you were talking about that are more in the longevity space that have happened over the last little while. And then we know that hyperbaric therapy has an effect on potentially telomeres as well. Although I don't know how much you think about telomeres and what your thoughts are overall with telomeres. I'm not exactly convinced that they matter when it comes to longevity markers, but maybe they do. But one of the other ones that I really was interested in that they came out with on the same study was actually senescent cells and decreasing the number of senescent cells or zombie cells in the body that are associated with degeneration, cancer, et cetera, et cetera. So very exciting research there, especially. And so we're using it a lot now for longevity, for performance, and then also for fertility as well.
I love that. When you mentioned sensitizing cancer tumors, can you go into a little bit more detail?
Yeah. So what chemotherapy is going to do is create an oxidative stress, like more of a stress on the system. And hyperbaric therapy, especially at deep pressures, and we can talk about the different types of pressures too, and what would be appropriate. But the deeper the pressure you go in the chamber, the more oxidative stress that you create. So it's kind of like a 1-2 punch kind of thing. So it makes the chemotherapy work a little bit better, depending on the type of chemo that you're using. And then radiation requires oxygen to work. So typically tumors are very hypoxic. They don't have a lot of oxygen getting into the actual tumor itself. And so if you can flood the system with oxygen, you're going to make that tumor more sensitive to radiation. So we're using it in that capacity as well. But those are a little more difficult protocols to do because you have to do hyperbaric therapy and then immediately get radiation afterwards, which is not that easy. But there have been some studies looked at this specifically for a type of brain cancer called glioblastoma, which is a pretty severe and deadly brain cancer that kills people within a couple of years typically. So
yeah. I've heard that oxygen, the presence of oxygen is kind of, absence of disease or something of that nature. Why is oxygen so incredibly important? Obviously, we need it to live, but what's the mechanism? Is it helping, to fight the chronic disease, or is it all of these other kind of cofactors with hyperbaric, like reducing inflammation? But what role does just the oxygen alone play?
Yeah. So do you mean oxygen just in general? You mean oxygen when we're in the chamber?
In the chamber, the excess of oxygen or elevated oxygen.
The elevated oxygen levels, the excess levels, they're the same. But the key with that is that when we're creating all this extra oxygen in circulation, we're pushing all this oxygen in 1,200% more. It's doing basically three things. It's creating a way to decrease the amount of low oxygen in circulation. So a lot of us have hypoxic tissues or low oxygen tissues, especially if we've had an injury like a traumatic brain injury. you can think of a stroke as an easy example. Like if you've had a stroke, all the tissue behind the blockage was lacking oxygen for a while and then has died. But not all that tissue is dead. Most of the tissue actually, comparatively, is actually still alive, but it's actually just not functioning very well. And so what that means is that you have this sort of gradation of injury. The way I like to describe it is if you have a still lake and you threw a rock into it, the direct impact of where the rock hits the lake is your stroke, where you have dead tissue, but you have all the ripples around where the rock landed, right? And so that's where the tissue's disturbed in some way. So if you've had a stroke, it's called the periischemic tissue. If you've had a traumatic brain injury, it's called the contusional area. I'm forgetting the name, but it doesn't matter. It's the same kind of idea. And so pericontusional area, that's it. And so, but all that tissue can kind of come back to life if you can get enough oxygen in circulation. So that's why the extra amount of oxygen, especially in the plasma, so it's not bound to the red blood cells, is so powerful because you don't have it bound, it's liquid in the bloodstream, it can get further into tissues. And so the depth that it can get across a membrane, like a blood vessel, is 4 to 5 times more. And so that may not sound like a lot, but it's a huge amount, especially if it's a very small amount of real estate. So you can potentially save all this tissue or regenerate all this tissue. So that's number one. You're flooding the system with oxygen, and you're kind of reversing all these low oxygen level areas that you might be having depending on the issue. The second thing is that the flooding the oxygen as well also creates that stress in the system. And that stress is a way for the system to release more stem cells. It's a way for the system to create those epigenetic shifts that we mentioned, so new blood vessels, decreasing inflammation. And all that extra oxygen also fights infection. So if you have certain types of infections that do not like high oxygen environments, they're not going to do well in a hyperbaric chamber. So this is very common for like mouth infections, for example, or wounds on the skin, like skin infections, like MRSA wounds, things like that. They do not like high oxygen environments. So I work with tons of people over the years with chronic infections that have done very, very well in hyperbaric environments. So all this extra oxygen does come at a cost, though, and we have to be careful of that. The cost is that when you're increasing the amount of oxidative stress in the system has to be able to respond with what are called antioxidants, right? And so you have your antioxidants like glutathione or vitamin C or melatonin or vitamin D, et cetera. These are powerful antioxidants. But if your system is not doing well, if your system cannot respond by creating these things to neutralize, you're going to get stress from being in a hyperbaric chamber at these extra oxygen levels. And that's why it's so important. And I emphasize, when I talk to patients, 80% of what I talk to them about has nothing to do with hyperbaric therapy at all. Because if they go in and they haven't addressed a lot of these things, then I know they're not going to do well in the chamber over the long term potentially. So the key for me is that I really want to know, if I have a good assessment of mitochondrial function and oxidative stress levels. If I have that, then I know where I need to compensate or where I need to support them so that they can benefit from being in a chamber over the long term or even over the short term if I can. Usually these are more long-term protocols that we're talking about when we're talking about somebody that has a chronic issue. So,
how are you determining mitochondrial function and oxidative stress load? Is it a test, or are you just, doing like symptoms?
So usually if I can, it's testing. So I use a lot of organic acid testing in my practice. So I have a framework. It's called Health Optimization Medicine. It was created by a colleague and friend of mine named Dr. Ted Achacoso, who's the founder of it. We actually have a nonprofit that trains practitioners on how to do this as well. And the whole framework is a health-focused framework, but the foundation of the whole framework is actually something called metabolomics, which is a big word, but metabolomics, all that really means, it's sort of the real-time assessment. That's what's happening in your cells, in the interaction from everything from your genes to your environment, kind of in one suite of testing. So your vitamins, your minerals, your nutrients, your antioxidant levels. Use organic acid testing, which I know you're familiar with as well. And nothing's perfect, right? Because you really need like a comprehensive understanding from multiple different arenas and sources, but organic acid testing can be really, really powerful. And so I use that as the foundation of understanding mitochondrial function. But I mean, you know this as well as I do, Kayla, like 95%, maybe 94% of the United States population has some element of mitochondrial dysfunction, right?
Yeah.
And so I know almost hands down that they're going to have some element of this already. And so if I can't get testing, it just kind of depends on what they're coming in for and understanding how I can support them. But that's when I use a lot of methylene blue, for example, because I know that's going to support their mitochondrial function, regardless of what they may be coming in with. And especially if I need to get them in soon and I can't do all the testing and get them on the right supplements and change their diet and get their gut all optimized and everything too. So health optimization medicine is my framework. That's what I use. And that kind of within that framework, that's the testing piece, and that's the lifestyle, that's the behavior stuff as well. And so, yeah, many people that are listening would be like, well, how do I know if I have mitochondrial dysfunction? The answer is that you probably do, but it doesn't mean it's terrible. There's a huge spectrum here, everything from very, very mild to very, very severe, even congenital disorders of mitochondrial dysfunction. So, but the key is to kind of know where you're at on that spectrum if you can, and the best way to do that obviously is testing if you can.
Yeah, and what's the brands of your favorite tests?
So I use Genova Diagnostics a lot, and what I like about Genova is that they have a very different normal level than most other testing companies. Most testing companies are using adults, which is about 18 to 65 to get their normals. Genova does 18 to 30, I think, is their normals, which is kind of where most of us want to be. The nonprofit and health optimization medicine, the whole framework actually is interesting, right? Because I don't want to be normal for 44 years of age, right? I want to be normal when I was most optimal, which is when I was 21 to 30, right? And that's what, that's what your deal is, and that's what my deal is. And so the whole framework is to shift all those levels to between 21 and 30 years of age. Like your all your nutrient networks, your hormone networks, because again, do you want to be optimized and normal for a 44-year-old, or that's how old I am? Or do you want to be optimized when you were optimized to be the most resilient, when you can fight, you can flee, you can fornicate, and you can do all those things and wake up the next day and ready to do it again, right? So that's the idea. And when I'm working with patients, that's the framework that I use, if I can, right? If they have time, if they're willing to kind of go through the effort, because optimizing health doesn't happen overnight.
No,
it happens for many of us if we've been sick for a long period of time. It's going to take us 6 months, a year. I've worked with people that it's taken me years. I mean, depending on their compliance and diet and lifestyle and how ready they are to make changes, right? So I truly feel that this kind of framework is really, really robust, but it's not the only answer, because we have to get people there, right? So how can we get people, and how can we help them right now while they're on that longer path to optimizing their health? Well, we can use things like hyperbaric therapy sometimes, but we have to be careful because we may not want to use it right away if they're not well optimized. And that's when I think about using things like methylene blue, as we've been alluding to, is because that can be a great mitochondrial optimizer and supportive while they're on that longer path to optimizing their health, which again, can take a long time if they're starting off with a lot of poundage and mitochondrial function to lose and gain respectively. So
I love that.
Yeah.
When it comes to hyperbaric medicine, and the amount of sessions, so they all require, optimally, you would do quite a few sessions. So I'm working through my first block, not my first. So we, have a chamber at the clinic. So I've done this before, but at my new chamber in my home, I'm working through my first block, 40 sessions. I'm doing 1 hour at 2.0 ATA. Why does it require so many sessions initially?
Right.
And, can you walk through some of these, like even the pressure and some of these terms?
Sure. So the first thing we could talk about is the pressures. So in the chamber, we can simulate the pressure of being under various types or amounts of seawater. And so again, you don't feel like you're underwater, everybody listening. It's just that you're simulating the pressure. So there's no water involved. It's just a pressure in general. So typically what we see is that milder pressure, somewhere around 15 feet of seawater to maybe about 33 feet of seawater, which is about a 1.3 to 2.0 ATA. So we use ATA as our definitions of hyperbaric therapy, as kind of like the nomenclature of all this. But so 1.3 ATA is about 15 feet of seawater, 2.0 is 33 feet of seawater. So that's the pressure range that we see that the most neurologic benefit, the most benefit from a central nervous system. So brain, spinal cord. The brain is more sensitive to oxygen and it's more sensitive to pressure. So the deeper you go, especially past 2.0, the more stress you might be putting on the brain. And so some of the studies actually have been done that showed a negative effect of hyperbaric therapy for things like traumatic brain injury, use too deep of a pressure overall. And so 1.3 doesn't sound like a lot of pressure, but 15 feet of seawater with oxygen involved in that, you're getting about 400% more oxygen in circulation. So that's the range, about 1.3 to about 2.0 to see significant neurologic optimization. But there's crossover here. I usually see 1.3 to 1.8 as being the best overall. And then when it comes to the system, like fully systemic pressures, that's 1.8 to about 2.4. So if you have something outside the central nervous system that you want to heal, and that's the pressure range that you're typically looking for overall. So if you have like a chronic inflammatory issue, if you have an autoimmune problem, if you have long COVID, for example, that's not just in the brain, that you have systemic symptoms, and that's the kind of pressure range that you're looking at. And Do you have a question about that before I keep going?
But no, I think that was pretty clear,
okay,
yeah.
cool. And then the other part of it is the protocol, like you described. Like, so if you have an acute issue, if you have an acute trauma, a surgery that you're about to go to, a acute injury, a stroke or something like that just happened, you don't need a lot of hyperbaric therapy to see a massive benefit, because all you're really doing is leveraging the system to work faster and more efficiently and better. And so you can see people getting, like I mentioned with the pre-post surgery stuff, 30 to 70% better faster. And that's a big range, but it also depends on what are you stacking with it? What are you doing in additionally? What are you doing before hyperbaric therapy? What are you doing during? What are you doing after, right? And that's a big thing as well. And that's big what I do, right? It's not just about getting in the chamber, it's that whole thing. So in general, you have these acute protocols, which are very short, maybe 2, 3, maybe sometimes 5 sessions, okay? But if you have a chronic issue and you're going in the chamber, that's when you're not just trying to rev up the whole system to heal faster. You have to change those epigenetics. You have to shift the expression of that DNA. So you have more healing, you have less inflammation, you have more blood vessels, and that takes more time. And it's the cumulative exposure of hyperbaric therapy over multiple days that really does the trick. When I was talking earlier, I mentioned something about, how you had the increased ability to utilize oxygen for about 24 hours after a hyperbaric treatment. So that's the reason for the cadence typically. So you do hyperbaric therapy once a day because you're maintaining that increased capacity to increase oxygen utilization, and you're showing that you're shifting the epigenetics, and you're doing it when you're doing it cumulatively like this 5 days a week. You're getting some solidification of those changes. But it's also important to have days off too. So that's when we're on protocols for longevity, for a chronic issue. Typically 40 sessions is kind of like a very common number that we're looking to go for, okay? But it's also important to take days off as well. Typically it's 5 days on and 2 days off. Now, the argument here, of course, is that whoever did the studies was taking the weekends off, and nobody needs to take the weekends off. It's just people that don't want to work on the weekends or something, right? But I think that actually, in this case, it's actually important to take at least 1 day off, depending on your system and kind of what you're doing it for, sometimes 2 days off. There's also protocols where I have people go in twice daily, actually, even for some acute issues or for more chronic issues. But even if they go in twice daily, there's a 4-hour break between their sessions, and they're definitely at least taking 2 days off a week when they're doing that too. So, but it's a cumulative exposure of hyperbaric therapy of the oxygen itself to the DNA, to the system, that's creating this epigenetic shift. And that's why it's important to go in for these protocols. And so I find that if people just kind of go in intermittently, they don't get the benefit, right? If they go in like 3 days a week or just kind of once a week and they're like, oh, I'll just go in and see how it makes me feel. I say no, unless you have an acute issue, or if you want to recover from jet lag, or if you have an exercise performance goal, you can see a benefit in just 1 or 2 sessions doing that. That's more of an acute thing. If it's more of a long-term benefit, that's why I tell my patients and people that listen to me, I'm like, if you have a chronic thing, you can go into a hyperbaric chamber once to see if you enjoyed the process, if it was comfortable, if you felt like everything was okay there, you felt safe, but it's not going to have any indication as to how you would do over a longer protocol, if you have a longer term thing going on.
Thank you for that.
Yeah.
So if I'm going to do the 40 sessions, how often do I want to do that block? Is it once a year, every 2 to 5 years?
Yeah.
And then what does maintenance look like?
Yeah, this is a really good question. So the answer is initially nobody knows because nobody's done these studies. What I can tell you is in the population that they were studying in Israel, they didn't look at them after 6 months, so they don't know. Okay. So, but my sense of this is that if you're otherwise pretty optimized, then, and you're relatively young, you probably don't have to do a full 40 sessions like that unless one every 3 to 5 years, to be honest. Maybe a little bit less than that, maybe 1 every 2 years, depending on the situation. Now, if you're older, like if you're around 50 years of age, like once every 3 years, or every 2 to 3 years. But I think, given at your age, I don't think you have to do it more than once every 3 to 5 years now. Okay. But that doesn't mean you don't want to use the chamber intermittently between that. So the way I think about maintenance is a little bit different than most people. So just to kind of high level, you have 2 major pressure ranges. You have the pressure range that's for the brain. You have the pressure range that's more systemic, right? This is the 2.0 pressure that you're using now. That's been studied as the longevity protocol. It's 2.0, 90 minutes in the chamber, 60 to 90 minutes in the chamber, okay? My sense of it is that if you're looking at it from a longevity perspective, you likely want to be thinking about doing a systemic protocol and a brain protocol either once a year or once every other year in stacking. So like 1 year you'll do a brain protocol, 1 year you'll do a systemic protocol. That's how I see it. Then in between that, or if you have an issue, so before I get in between that, if you have an issue, like if you've had a stroke, for example, if you've had a traumatic brain injury and you didn't get completely better after getting hyperbaric therapy, but you did get better, then what you may want to do is actually do that in more frequent maintenance ways. What I mean by that is that, so like if somebody came to me and they said they had a stroke, right, and they got better after doing 2 atmospheres in the chamber, 60 minutes, 40 sessions, they got 80% better. Okay. So what I mean have them do is have them do maintenance therapy for a period of time. And I'll talk about that in a minute. But then in about 6 months, I'd have them do a smaller amount of sessions at that same pressure again. And then every 6 months, I'd have them do a smaller amount of sessions at that deeper pressure in perpetuity, or at least for a period of time while we watch other things. But because my sense of it is that that's the cadence that's needed if you have an injury or if that you have more stress in the system that requires you to do it more often. But the maintenance period is interesting. The maintenance period is when you're going in my definitions, like on average, maybe about 2 to 3 times a week. You're kind of, during maintenance, you're kind of optimizing your hyperbaric sessions to when you're going to need them the most. Like say, for example, you just got off an airplane. You just were low oxygen on an airplane. You can use hyperbaric therapy during that time you get off the airplane, and you hyperoxygenate yourself. You go for 3 days, you're going to feel great. Okay. So you can use it in that capacity. You can also use it as an exercise recovery tool. You can also use it for sleep if it helps you sleep. You can use it for more energy if you pair it with your cold plunge, for example. I have a great protocol that I love. I don't have a cold plunge, but I do it in Colorado, where I will have just go in front of my lights, and then I'll go into the chamber for 30 minutes, and then you jump in the cold plunge and you feel like $1 million, right?
Okay,
so
we need the protocol though. So red light for how long?
Red light typically for 7 to 10 minutes,
Okay.
Depending on the type of red light you have.
Then chamber.
Then chamber for about 30 minutes.
Okay. Is that, so 30 minutes starts so after it is fully pressurized?
Yeah.
Okay.
Fully pressurized, yeah. And then jump in your cold plunge, yeah.
And then cold plunge. How long do you do the cold plunge?
Just a couple minutes, yeah. Nothing longer than that's needed, yeah.
Nice.
Yeah. That's kind of the way I think about hyperbaric therapy in general. It's like this comprehensive plan for people. It's not just going to the chamber. It's like, especially when you're on maintenance and you're kind of doing 2-3 times a week and you're just kind of doing it to try to really help out and leverage the other things that you're doing. It's really great to kind of think about how can I use lights? How can I use sauna? How can I use my cold plunge? How can I use my PEMF mat or whatever, like all the things that you have?
It's a full-time job, I'm telling you.
It can be, but it's a fun one.
It's the best. That's why I'm so blessed that like my professional and my personal interests are so aligned because otherwise it's a lot of time.
Yeah, I've created so many protocols over the years working with people, and it's always about understanding how we can leverage the chamber in the sense that the chamber is this fantastic healing, optimization, accelerating device. And so that, what do we want to do? Do we want to run a marathon in 6 months? We can help you do that. Do you want to do even crazier, like an ultra marathon? We can do that too. Or do you just have a surgery coming up and you want to get back on the field as fast as possible? We can do that as well. So with more planning comes better results, as we know, if we can. But then we can say, okay, well, let's use lights before, or let's use sauna afterwards, because there's more detox that's required after being in the chamber. And the other thing I should just mention is that when you're on more of a maintenance kind of mode, if you have the capacity, like in your chamber, for example, to go 2.0, you don't always want to go to 2.0. You want to vary the pressures that you go to. It's just like you're going to the gym, right? If you're going to the gym and you're exercising, you don't want to do the same exercises every day. You want to change them up because that changes how your body responds, and that's how your body responds in a more optimal way over time, right? It's the same thing in the chamber. It's the same thing that. So you're on maintenance mode. Sometimes you go to 1.3. Sometimes you do 1.5. Sometimes you do 1.7. And I can share with all of these things to you as well, Kayla, as you know. But for those that are listening, I think the key is that there's a huge amount that you can do with the chamber. There's a lot of potential. And then even if you have a chamber that goes to 1.3 or 1.5, that's more of a mild sided chamber, there's a lot you can do to kind of stack and optimize that with increasing blood flow before. For example, we talked about lights, but you can also use things like nitric oxide boosters. You can use, again, the methylene blue that we talked about before to kind of help stimulate the system to maybe even have the capacity of being at a deeper pressure that even you're not at. So like, even though you're at 1.3, we can might get you to 1.5 just with a little bit of blood flow stuff and other things to kind of help out along the way.
That makes a lot of sense.
Yeah.
Any other fun, exciting studies? I mean, I loved it when the study about the telomeres came out and anti-aging and senescent cells. Anything else that we want to talk about?
I mean, there's been a lot of great studies on long COVID over the last couple of years, and I think we're seeing a huge amount of benefit using hyperbaric therapy in that capacity. So long COVID, if you have it, hyperbaric therapy can definitely be an option. It may not be the first thing that you go to, as I was alluding to earlier. You may want to work with somebody that can help get your nutrition and optimize your gut, because oftentimes the gut is a big part of the long COVID symptomatology, unfortunately. So long COVID is a big one. There's been a lot more in the regenerative space. There's been a couple combining hyperbaric therapy with PRP, which are pretty cool, especially in rugby players, interestingly enough. They've also looked at cardiac function, so looking at cardiac capacity or VO2 max in patients, and your VO2 max does go up after doing a protocol of hyperbaric therapy as well. This is not just 1 or 2 sessions, everybody. This is more like a 40-session protocol like you're doing. At least 1.8 probably in pressure ATA, which is again about 28 feet of seawater, somewhere around there. And so there probably is a benefit at the milder pressures. It just hasn't been studied. But certainly the major benefit that we've seen is at the 2.0 pressure for VO2 max increases. There's also been a decent amount of studies on many different things, but the other ones that were a little bit longer ago, but that were very good, were on traumatic brain injury as well. And so like a lot of benefits in patients with concussions. I'm trying to think of what else recently that's kind of crossed my desk, but
well, I like the fertility.
Yeah, the fertility ones. Yeah. So there's been so thank you for the reminder. Yeah. There's been a number on fertility over the years. And it's funny how many people get pregnant using hyperbaric therapy. It's because the ovaries and the eggs are so highly metabolically active, and sperm is as well. So there's actually been studies showing that sperm quality goes up after a full protocol of hyperbaric therapy. They haven't looked at egg quality as much, interestingly enough, but they have looked at the uterine lining, where the uterine lining needs to be a certain thickness to be able to have the implantation of the embryo, and that increases with hyperbaric therapy as well. Now, why aren't women and men getting pregnant is because they're not fertile due to inflammation, toxins, the environment that we live in now. So the real deal is to clean up the mitochondria, the terrain, the foundation, and that's how to get, this to be less of an issue. But it's an issue, as we all know, because of there's microplastics in sperm, right? I'm sure they're in ovaries and eggs now too. I'm sure. I don't know.
No, they've been found ovaries, eggs, placenta. I mean, I actually don't know if it's confirmed eggs, but ovaries confirmed,
placenta for sure.
Confirmed.
So, for sure.
I mean, every major organ. Well, mentioned like this, but hyperbaric oxygen, because of the revascularization, right?
I know where you're going
can
with
help with erectile dysfunction.
I can't tell you how many guys have come to me after their hyperbaric session. It doesn't matter. It's been like even the mild chambers sometimes. And they go, Dr. Scott, was I supposed to feel like that in the chamber? I'm like, oh yeah, that means your vascular supply is actually, that usually means that there's a need, but there's also a significant benefit that if they go in and do a full hyperbaric protocol, that they're going to see significant improvements in erectile function as well. So there's a study that was done out of Israel as well that looked at erectile function. It's one of my favorite slides to show when I do presentations. It's a functional MRI of the penis, but nobody knows what you're looking at when you're looking at the slide. And it's always fun to say penis on stage at least 4 to 5 times to get people out of their funk. Everybody's listening like so intent or sleeping, and I just say penis 5 times and like, that's a penis, and they always enjoy that. So so before and after blood supply of a penis, looking at functional MRI imaging. So yeah, for sure. And this could be obviously for people that are in the longevity space and want to have better erections, men, but also in people that have had significant issues like diabetes or high blood pressure for long periods of time, or they've had radiation exposure in the prostate or that area. We can get them erections again, and that's a big deal. So it can go across the spectrum of health is what it comes down to.
How many sessions? Was it 40 sessions?
Typically it's about at least 30 to 40 sessions to see that kind of benefit, because you're looking at rebuilding the vascular beds in these tissues, and the penis is no exception. You have to get new stem cells in the area. You have to create new blood vessels. You have to decrease inflammation. You have to do all those things, and it takes time.
Yeah. That makes a lot of sense.
Yeah. But women also like hyperbaric therapy for this reason as well, because there's more vaginal engorgement as well. Now, again, they won't tell you this unless you ask in general, but it's the same deal. It's just, different physiology, but everybody enjoys their time in hyperbaric therapy, especially if they're trying to have babies, because everybody enjoys the process of of having babies more. So that's always
I mean, absolutely. That makes so much sense.
Yeah.
Well, I've been doing this, there's a couple of factors, so it's hard to pinpoint exactly, but since I've gotten my chamber, I mean, my HRV has just been skyrocketing. I will say too, I have cut down on my coffee consumption. So I was having like 2 cups ish a day.
Yeah.
Now I'm doing like half a cup because I'm getting ready. As I told you earlier, I want to have like 7 babies.
I love it. Yeah, I have 4. It's a lot.
I mean, big families. I mean, we need to create healthy children that can lead by example.
Yeah, I used to say that I just like waved at my wife and she got pregnant by the end of it. So yeah,
that's great.
Yeah, but fertility is, 7 kids is a lot. Yeah.
It is definitely a lot. But so I'm doing all this, like really just focusing on stress. I'll be honest, I've always seen stress as a great thing.
Yeah.
You know, I've never felt like my stress has been uncontrolled. I've never been upset by being stressed. You know, I mean, I run multiple businesses. Like it is what it is. And I've thrived off of it. I love it. I think part of it is how you perceive stress.
Of course. Yeah.
Which for the first time in my life, I'm like, okay, now I know that, you know, to get pregnant, you want to reduce stress. So I'm finally doing that. So combination of stress reduction on purpose, a little bit less coffee, but I mean, my HRV is just like going to the moon.
It's beautiful. Yeah. And that's a good sign of overall balance between your sympathetic and parasympathetic nervous systems, right? So, and that's what HRV is all about. The interesting thing about hyperbaric therapy is that in some people, their HRV might get slightly worse when they first go into the chamber, because it does cause a little bit of that oxidative stress. But it's a really good sign for you that your HRV has gone up so quickly. So oftentimes I'll see that after 5 or 10 sessions, the HRV is going to start really climbing.
Oh, nice.
Or if they're using milder pressures and using it for exercise recovery, because of course, if you've stressed yourself at the gym and you're vomiting yourself because you're working out so hard, like that's going to mess up your HRV. But then if you go into a chamber, and you're going to see a bounce really, really quickly that way too. So from like an exercise recovery, jet lag, especially at milder pressures like 1.3, 1.5, even 1.8, we'll see HRV go up short term for people that have like more of an acute stressor. But if it's more like a long-term protocol like you're doing, oftentimes at deeper pressures, you'll see their HRV actually go down a little bit before it goes up after 10 to 20 sessions, interestingly.
Interesting.
Yeah.
Well, that's another thing that I love about your company. So one base, which is the hyperbaric chamber I have, and I also have a code that will include in the show notes. And, we were just chatting about how like picky I am and, anyways, but if you're looking and you're in the market for hyperbaric chamber, I have the hard shell chamber, but you guys have amazing, the soft shell chambers.
Yeah.
But what I've never seen before, obviously you and I have been going to health optimization, biohacking conferences for like over a decade. So, but I've never seen a company that has had an app like yours and it actually walks you through the different protocols for people. I feel like that's like amazing because it's a complex thing, right? It's a medical device. Like not everyone just knows how to use it or understands why. And, you have so much knowledge. So it's like jet lag protocol and, improving this or recovery. I mean, I love that. So.
Yeah. And we're just getting started there. I mean, that's the whole ethos of the company. When I started it with my co-founders was, I was tired of people contacting me like 6 months or a year after being in a hyperbaric chamber and not getting the results they wanted, or being told that a certain type of chamber would do certain things and it just doesn't do that. And so I really wanted to create, like, my big thing was not so much about the chambers, but more about the education. But as we were doing that, we realized that we could create this huge ecosystem where the chambers were a big part of that, where we can actually create software and hardware to make them work better, work faster, work safer. And so we have all this new sensor technology that's going to be coming out in the next 6 months. We have these new capacities for you to integrate your wearables and get more data from the chambers in real time. And that's the next evolution of what we're doing.
Wait, is mine going to do that?
We're going to have all that for you. Don't worry. We're going to retrofit you.
Okay.
Yeah. But it's the key for me, it was initially the protocols, right? Because people just didn't understand that if it was an acute issue, you did this. If it was a chronic issue, it wasn't going to happen the same way. And you had to have more of a foundation. And so that's what my clinical practice is all about, like creating that foundation, creating tools and technologies to help people. But what I wanted to do with the app and with the education was at least give people an idea of the framework here, right? So what are you trying to do before hyperbaric therapy? You're trying to help dilate blood vessels so you get more oxygen where you want it to go. And you want to make sure you can make the energy with all the oxygen that you're putting in there, right? And so that's your B complex vitamins. That's your minerals. That's your methylene blue and others. But then not only are you making all that energy, you have to make sure you have that capacity to neutralize all that oxidative stress like we mentioned. So what are you doing after hyperbaric therapy? You are looking at your sauna, right? Because sauna is a great way to detox, and you have a great one outside. So I use mine every night, right? And so it's a great way to detox afterwards. You can also use your pulse electromagnetic field technology, your PEMF mats, as a great way to detox post hyperbaric therapy too. But nobody was talking about that. And I have to give credit where credit's due. This is a Dave Asprey thing, right? So I met Dave many years ago, and when he was looking at the bulletproof lab or upgraded labs as it is now, and he was looking at how you can connect all these technologies together. And this is what kind of my thought process was like, well, holy shit, why aren't we doing this with hyperbaric therapy? And then that's kind of what spurred me to do this over the last decade or so in various different ways. But the app is kind of the culmination of my clinical practice and trying to make it easy for patients and people that aren't my patients to just enjoy and understand a framework there. And the future of the technology is what I'm really most excited about, is because now we can see how all these metrics are working when you do your protocols and after the protocols and before, and then how we can kind of change things over time. So I'm very excited about it overall.
Me too. I'm so excited. Hi guys, I'm going to interrupt this episode for a brief announcement. As you may or may not know, I started a community for females by females, and it's a female longevity optimization community. This is a place that you can connect with like-minded women. We are all here to support each other, and there's a variety of different benefits to being a member. You get a monthly Ask Me Anything, so submit your questions and I'll answer them directly. We also have an entire library of courses on all of the important components of longevity, such as labs, nutrition, exercise, sleep optimization, longevity optimization protocols that I'm doing, along with real-time updates to my personal protocols. There are so many benefits of being a member of the community. We'll also be doing in-person live events here in California and virtual events for anyone that can't attend. But if you're interested in joining the community, I would absolutely love to see you there. And I will include a link in the show notes. Yeah. So we've talked a little bit about, biomarkers, and this again is going to be really unique, right? Because let's say if you have really high levels of inflammation, then maybe that's like your hero biomarker that you're looking for in the chamber, right? But are there any, let's say someone's pretty much optimized, they're happy with their blood work, and their doctor's happy with their blood work.
Sure.
Those could mean two very different things.
Very true.
Yes.
Yeah. It also depends on what your blood work is for, right? Are you optimizing for a marathon? Are you optimizing for golf? These things change too, right? So,
totally, yeah. But what would be some biomarkers that might be able to be looked at, in terms of hyperbaric oxygen?
Yeah, so what it comes down to, it really depends on your specific goals. But the ones that we talked about HRV already, so you should see that your HRV does improve with hyperbaric treatment overall. The other one is VO2 max. So if you're doing a full protocol, you should see a VO2 max increase overall. If you are looking at like other types of biomarkers, there's not that many that we can really see. Most of this is going to be subjective, but I'm working on that. That's the idea. So the idea with OneBase is how can we find some of these more objective measures that people are monitoring on their daily ring, for example. So can you measure your deep sleep? Can you measure we talked about HRV, can you measure your REM sleep, for example? Can you measure your stress levels? Now we have all these patterns that we see on our Oura rings and things like that. So I'm working on understanding these things better, but we don't know yet. We have a pretty good sense of HRV. We have a pretty good sense of VO2 max. Those are the two major ones overall. And then a lot of them are kind of goal directed. So if you will see people, like, for example, from a recovery perspective, or using it for exercise, you will see their deep sleep go up typically, and you will see their need for overall sleep go down. So I've worked with a lot of athletes that like do marathons and do like a lot of endurance racing. And these guys and gals typically need a lot of sleep to fully recover, like at least 9 to 10 hours a night. But I've seen that their numbers go down and they only need about 8 to 9 hours instead of 9 to 10. So that could be very beneficial, of course, overall. So you can train more or hang out not sleeping more, which is kind of nice, I guess, if you're already sleeping that much. But that's kind of the Pandora's box of where I'm looking to go with OneBase, is that now that people are just tracking so many things, I mean, you would be the ultimate example of this, but there are people that are just have a ring like I do and just tracking all the various metrics now that the Oura ring is giving you. The key for us is to get enough of a data set over time, is that we can really understand what's happening when people are using the chamber in various different ways. I have an inclination of what's going to happen, but I don't know for sure because it hasn't been measured. It hasn't been tested. But that's where you're doing collective data collection overall and getting a lot of data points with our sensor, our new technology is going to be very, very exciting.
Love that. Yeah. Aura added hyperbaric on the tags.
Oh, did they? Oh, nice.
So
did you help them? Did you ask them to do that?
I mean, I've mentioned it a lot, and I have a relationship with Aura, but yeah, that's
good to know.
That's really good to know. I was excited to see that.
Yeah.
I would have to assume that it would make a pretty Well, obviously, so we can't say one thing in isolation, right? Like if you're leading a poor lifestyle and then you're doing hyperbaric, probably not much is going to happen, if anything.
Right.
But when it comes to like biological age testing and these, methylation markers, what do you think the impact is there?
So the answer is we don't know yet. Yeah. I think that there probably is going to be a benefit, although I have a lot of, what's the word? Contempt for biological age testing right now, because I think a lot of it is just, it's too early to know. Yeah. I think some of these more unique clocks that are happening, the ones that are, maybe you've already tried these before, but I haven't yet, the ones that are specifically for tissue ages, like organ specific ages, sound very interesting to me. But when it comes down to methylation ages, like epigenetic age, even glycan age and these other companies, they're very easy to game is what it comes down to. Like if you go, and I don't recommend this, if you go plant-based for 6 months, you're going to see reversal of some of these markers. But then if you lose 20% of your muscle mass, is that a good idea? And this is very hit home with me specifically because I have a friend of mine who's an epigenetic researcher. He's like, my mom is 79 and I could have her age reversed by a couple of years if I had her go full plant-based, but then she'd lose all this muscle mass and she would have a high risk of dying from hip fracture, right? So I don't think that we have enough information there with all these biological ages tests to really know how beneficial they are long-term, right? So with that said, I do think that hyperbaric therapy may have a beneficial effect, at least in the short term, on some of them. I don't know which ones exactly. I think on the epigenetic ages specifically, but we're actually looking at testing this as well right now.
Yeah,
and maybe we can do this with you if you're already testing your stuff, right?
I am. And I have the newest true diagnostic test I need to take in there, which is some of the organ ages. But I mean, I couldn't agree with you more because, I am not a medical doctor, but I will work. So we have medical doctors that work at Live. And then a lot of times I only will even join, calls with like our top tier people at this point.
Right.
And then I kind of consult on some of the fun longevity stuff, based on conversations with people like you.
Yeah.
But you can't you can't see what it's the saying about seeing the forest through the trees. Like you can't focus on this one metric if you have all of these massive issues over here that you need to address: gut health, bone density, muscle mass, because just as you said, some of the things that we know will, impact those clocks can also be detrimental to you. If you are 50, 60 years old and you don't have enough muscle mass, but you need to eat more and you need a lot more protein, well, that's going to probably move it in the wrong direction, but it's actually going to benefit you long term. So we totally align on that.
But I think that looking at these markers is something I'm really interested in, and understanding. You talked a little bit about inflammatory markers. I'm actually interested in people that have normal inflammatory markers and what changes if we make them more normal or more optimal, even in that range, because there is a range there as well, right? So, and what is that range coming from? That's another question, right? How are you finding that range? Most of these labs are using normal ranges of somebody between 18 and 65, or if it's like a thyroid level, you're getting an average between somebody 5 and 92 years old. So like, why do you want an average in that?
I mean, there's like zero of my labs pretty much outside of like, blood cell counts essentially that I look at in terms of the normal ranges.
Exactly.
Mine are, custom developed optimal ranges, which is far smaller than
and they should be
massive.
Right.
I mean, vitamin D is like 30 to, is it 20 to 7 or it's 100?
30 to 100, I think.
30 to 100, right? And then so you have all these people walking around with a 30 vitamin D thinking they're like fine. And it's a complete disaster.
Yeah, I know. It's nobody wants to be normal. I think that's what it comes down to. And there's no such thing as normal. That's what I tell my kids all the time. But you shouldn't try to find the mean there. You should try to be as optimal as possible. I mean, that's what you're all about. And that's what we have. Again, I mentioned this nonprofit, that health optimization, right? Trying to optimize people. Even if you're, feel like you're healthy, and just because you're not sick doesn't mean you're well. It just means you're not sick. And that's what Dr. Ted likes to say, from the founder. And that's the big thing, is that most of us don't realize that we have these sort of underlying things that are just accumulating over time and that we just don't see. And then all of a sudden we just hit some sort of threshold, and then all of a sudden, in quotes, we're sick, right? All of a sudden we can't pick up our kids anymore. All of a sudden, we can't wake up in the morning. But this didn't happen overnight most of the time. Most of the time there is just a slow, methodical thing that's happening and that we're compensating for because we're young enough. And then unfortunately that young enough is getting younger and younger, sadly, really just because of the toxins in our environment and just the stress that we have and not all that good stress, or all that stress that just accumulates over time. So I'm just a big fan of just trying to look at that comprehensive picture and trying to help people along the process as much as possible. That's what it comes down to.
No, I mean, I completely agree. It's sad because it's like being healthy. I kind of said this before, but it can be a full-time job, but it
Yeah.
also, it's so overwhelming to people. Like it shouldn't be this way. We shouldn't have to do so much
Yeah.
in order, it's devastating. When I was in Ohio and I was just working, that's all I was doing. So I wasn't even like out socializing much.
Yeah.
But now since I've been like socializing a lot more here in California, and maybe people are telling me this more because I'm like in the health industry, but every single person, every woman I've talked to, I'm not kidding, has some sort of chronic condition.
Yeah.
It is so sad. And these are people that are in their early 30s.
Well, they're on
mid-30s.
antidepressants too, like or anti-anxiety meds.
Something is
yeah.
going on with, like, mostly I hear a lot of autoimmune, a lot of PCOS,
Yep.
endometriosis. It's just, that's devastating to me. And they're trying and they're living a life that they think is healthy.
Yeah.
And then people look at what I do and it seems so extreme. It's like, okay, but I have zero chronic conditions, like,
Right.
and it can feel extreme, but once you integrate it the way I have, it doesn't feel like that at all. Like
Yeah,
my
I
house
understand.
is just optimized to be low toxin, you know what I mean?
Yep.
But it's like going through every single little thing. The floors are hardwood instead of carpet, and
Mm-hmm.
the paint is not off gassing, and the sauna is not off gassing, and the bed's not off. It's a lot, but if you walk through it slowly, it becomes second nature.
And that's what you do for a living, help people walk through it slowly so they can do it, right? But I always say that you can get 90% of the way there by doing the basic
Yeah.
things. And then the rest of the 10%, like that just takes time. Like
Yeah.
it's just like if like you're an elite athlete and you're trying to get to that next rung, it's like 1/100th or 2/100th of a second faster, right? That's really hard to do.
Yeah.
But to get all the way there, like a lot of you can do it, right? And then that's what I tell my patients all the time. I'm like, as compliant as you can with the diet, the behaviors, the supplements, the lifestyle that we're asking you to do.
Yeah.
And then we can give you some things along the way to help with it, whatever that might be, to try to make you feel better right now. But you got to do the work. But you don't have to do all of it. Like
Yeah.
I talk about Brian Johnson a lot. I mean, we talk about you in the sense of how much that you're doing, but I'm sure you would relate that not everybody has to do what you do
Yeah,
to
no.
get 90% of the benefit, right?
Without a doubt. And all the things, as we talked about earlier, it's like all the things that are, because there's so hefty costs associated with doing it so much, right?
For sure.
But all the things that move the needle the most are free or very low cost. High quality sleep, it's the things you do every day, right? How do you sleep? How do you eat? How do you breathe? How do you move? And how stressed are you?
And how do you relate, or how do you relate with others and your relationships as well?
Yeah,
right? So,
absolutely. Like
yeah.
your social community
Yes.
and your ties. So
Yeah.
all that stuff outside of food, I mean, that obviously has a cost, but
right. Yes, most of it otherwise is free or very close to it, right? I mean, it's already part of your daily life. You have a bed to sleep in. You can just sleep in it more, right?
Yeah.
You have people that you love, talk to them more,
Yeah, yeah.
or turn off your phones more, whatever it might be, right? So I mean, it's all about that foundation, right? And so that's what I always try to tell my patients and the people that I work with. And then that's why I mentioned in the beginning, or maybe in the middle when we were talking, is that 80% of what I talk about with people is nothing at all to do with hyperbaric therapy. Now, typically people will find me for that. Or they'll find me now with other things like methylene blue and others. But in general, it's about hyperbaric therapy. And I'm like, we'll get there, but let's talk about the other stuff that brought you to me, or why you think you need hyperbaric therapy. Like, oh, I have cancer. Oh, I have migraines. Oh, my mom has dementia. And we have some really, great studies that hyperbaric therapy can be helpful, especially in the early stages. But if you're just doing the things that gave you dementia and you go in a hyperbaric chamber, it's not going to last. It's not going to change anything if you're not changing any habits or lifestyles or diet or anything like that. So I try to frame it that way. And I think people acknowledge that it's although it's difficult for Americans to acknowledge that there's not one thing that's going to help them. It's going to be a multidisciplinary road that can take 6 months, a year or longer to see the benefit. But that's what I try to convince people, one step at a time, but that it's going to be a road to get there. So.
No, I love that. I mean, the saying, you can't heal in the same environment that you got sick in. It's like, you can't, if nothing changes, nothing changes. So.
Right. Yeah.
But it doesn't have to be as overwhelming as it can feel. You just chop away at all these changes.
For sure.
Okay, so I have one more question about hyperbaric, and then we'll transition into methylene blue.
Sure.
So when it comes to, we've seen like LeBron James sleeping in a hyperbaric chamber, and I think Justin Bieber. When it comes more so on like the LeBron front, with professional athletes, how can it give them that like little edge? Is it the recovery aspect?
It's
Is
mostly
it
the recovery.
anaerobic?
Yeah.
Okay.
Yes, most of the athletes that I'm working with and I've worked with over the years, it's purely a recovery tool. Most athletes are overtraining. They're just training too much. And as a result of that, they're creating inflammation in the system. And so I don't usually use very deep pressures in a lot of athletes either, because the deeper the pressure, the more stress you're putting on the system as well. So especially if they're in season, like you don't want to go to deeper pressures because it can cause them to have more of an oxidative stress, and actually they can get sick as a result of that. So
What
you have to be
pressure
careful.
do you usually keep it on?
Typically between 1.3 and 1.8, depending on what they're doing. So the only other exception to the recovery piece would be prophylactically. So I have used hyperbaric therapy at milder pressures, like 1.3 to 1.8, for people that are going to hit their head a lot. So boxers, I don't like working with boxers, but I will sometimes, and also football players. So, and even hockey players too. So these guys and gals, mostly guys that I've worked with, they have a high risk of hitting their head. There's been some studies, at least in animals, that if you use hyperbaric therapy before you give an animal a brain injury, their brain injury is much less compared to what they would have been if they didn't get to a hyperbaric chamber ahead of time. So I try to get them to use hyperbaric therapy before they go into like the hockey rink, or go on the field and play, if possible, as a prophylactic measure. But in general, we're mostly using it as a recovery tool. So using it for mild injuries, day-to-day operations kinds of things, more severe injuries, of course, as well. But sort of day-to-day recovery typically is the way. And just to kind of put an emphasis, I don't recommend most people sleep in a hyperbaric chamber.
Yeah, I hear
Typically about 2 hours is as much as you want to spend in a chamber.
Yeah.
Anything more than that is going to cause too much stress in the system typically. These athletes will do that. They probably aren't doing it every night, I hope. But in general, I don't recommend doing more than 2 hours in the chamber at a time, because there's too much oxygen exposure over that time overall. So even in mild pressures, I don't recommend doing it. There was a picture of Michael Jackson back in the 1980s sleeping in a hyperbaric chamber. And that became this whole craze about hyperbaric therapy, Michael Jackson, anti-aging, that's what he was doing. It's that was the whole tabloid, but actually he was actually using it for recovery of third-degree burns that he had on his head. That happened after being filmed in a Pepsi commercial where we had these burns on his head from it. So you weren't alive at that point, but but it was a very fantastical thing that was in the news and tabloids, but he actually ended up donating his chamber that he had at his house to Cedars-Sinai burn ward after he was done with it. Yeah, so there was a real reason why he used it, but he was filmed sleeping in the chamber, and so another fun person to put on my slide decks when I use. Yeah. When I give presentations on hyperbaric therapy, I can talk about. He was the most famous individual in a hyperbaric chamber by far. So
yeah, absolutely.
Yeah.
Okay, so let's transition to methylene blue now.
Sure.
I love that. I've loved methylene blue for many years. I've done it in, I think, all the forms you can do it in.
Sure.
I've done it at IV, oral, troche with your company.
Yeah.
Transcriptions. What is methylene blue? What is it doing, and how do we use it?
So methylene blue it's a dye. Actually, it's a blue dye, and it's been around since the 1800s. It used to be used as a dye for blue jeans, actually, back in the day. But they found out that it had all these potential powers as an anti-infective initially, and that's in the 1890s or so. It became the first treatment, the first antimicrobial available. So high doses of methylene blue are really powerful anti-infectives for bacteria, fungus, and virus, and even COVID, actually. Some pretty great studies on that. So these high doses still work very well. And the cool thing about methylene blue at these higher doses, this is about 1 milligram per kilogram. This is like 50 to 70 milligrams of methylene blue, just to kind of give a feel for people. These higher doses have never shown to have any resistance patterns when it comes to treating infections. Most antibiotics, as most of you are listening will know, is that most antibiotics stop working after a period of time because the bugs become resistant to that particular drug. But that doesn't happen with methylene blue because the way it works in the system is a little bit different. It actually creates this product called hydrogen peroxide, which people have heard of before. It's a cleaning solution, but it's also something that our cells make to help kill bugs. And so our system makes more hydrogen peroxide at higher doses of methylene blue to kill these organisms. So it's still used now as a preventative for urinary tract infections. It's used across the world now, again, for malaria, because those drugs don't work anymore as much as they used to, unfortunately. And it's being used now much more for viral infections, fungal infections, et cetera. But in the 1950s, that all stopped because antimicrobials came around and methylene blue wasn't being used for that anymore. And then it was used as a derivative for the first antipsychotics, interestingly enough, because methylene blue has this capacity to increase some neurotransmitters like dopamine, serotonin, and norepinephrine. And so it increases your mood, it makes you feel good. But the first antipsychotic drugs were actually derived from methylene blue, interestingly enough, as well. So it has that history. And then the main history that I care about and that you care about is mitochondrial history. So over the last several decades, we know that methylene blue concentrates in a part of your cell called your mitochondria, and it increases the amount of capacity for you to make energy, and it also increases your capacity to detoxify at the same time. There's very few compounds out there that do both. Most compounds will either increase the amount of energy you make, or they'll give you like a detoxification burst, like vitamin C is a good antioxidant, right? But it doesn't give you energy. What increases energy, caffeine gives you energy, but it doesn't give you really a whole lot of antioxidant capacity. A little bit with the polyphenols maybe in it, but mostly it's just an energy enhancer, okay? So what methylene blue does is it has the capacity to do both, and it can do it in the same cycles of making energy and detoxing. So it doesn't put a lot of stress on the system. That's why I use it so much in my patients, because it has the capacity to do both. And so it's not putting a lot of stress on the system when you're adding it on to somebody that has mitochondrial dysfunction, which, you know, as you and I were talking about earlier, this is just rampant. 94% of the United States population has mitochondrial dysfunction. So if we can compensate for that by using some methylene blue, we can see fantastic things happen with energy production and also detoxification. So what does that mean in real time? So we can see people with chronic issues like chronic inflammation, autoimmunity, chronic fatigue, long COVID. We see such fantastic capacity to support their mitochondria, which are just trashed because of chronic complex medical illness, inflammation, infection, and we can see that support there. And then as a result of having that support, they can feel better, really fast sometimes. Like sometimes even in days once you find the right dose. But the mitochondrial dose for methylene blue is much lower than the infectious dose. Okay, the mitochondrial dose of methylene blue is around 4, 8, 16 milligrams of methylene blue, compared to sometimes a little bit higher than that, but that's like the range. As opposed to the infectious dose, we're like treating infection somewhere between 25 and 175 milligrams of methylene blue. So in some like acute infections, I will use up to 2 milligrams per kilogram, so like around 150, 175 milligrams. But in general, for more chronic infections, you use lower than that, and then you can titrate up. But the key with the methylene blue is to know that there's kind of two doses. There's like the mitochondrial dose, which is like the lower dose, and then there's the infection treating dose, which is the higher dose in that capacity. But I use it so much over such a huge swath of different types of patients, everybody from elite athletes. I just had an ultra marathoner that I was working with, this race called the Leadville race, which is it's a 100-mile race. It's the hardest 100-mile race in the country because it's all at elevation. It's in Colorado. And he was using the methylene blue, and he had a 3-hour less time than he did this year compared to the last year before.
That's amazing.
Yeah. So it's going to be fantastic for endurance because it actually can work just like oxygen in your cells too. So everybody that comes to Colorado and comes visit me, I also give them our methylene blue as well, because so oxygen's required obviously to make energy. And if you don't have enough around, you don't feel good. This is why you're on an airplane, you don't feel good. That's actually why you get more tired on an airplane initially as well.
Can private planes just like put more oxygen in there and then it'll be like a hyperbaric chamber?
So they won't make it a hyperbaric chamber, but what they can do is they can pressurize it closer to sea level. And that's expensive because the more oxygen makes it heavier. And so, but the best, the fanciest private planes in the world are pressurized to sea level. So they're pressurized at 21% oxygen. So instead of being pressurized to 8,000 feet, which is where I was just earlier today, they're pressurized to sea level. So the Dreamliners, like the fancier ones that everybody's heard of over the years, these are pressurized to 6,000 feet. And that's why they're touted to have less jet lag when you get to your destination, because you're less hypoxic, as a result of it. So I use a lot of methylene blue for jet lag, actually. So I have patients that'll take it. I have a good protocol that we've developed to take it before you get on the plane, during your plane, and then after you get off as well, to help support mitochondrial function, decreasing inflammation, decreasing oxidative stress, but also increase the amount of energy you can make. So that's really cool. Another way you can think about, but anybody that comes to Colorado, I'll always have them take their methylene blue because it can act just like oxygen and help you make energy in that mitochondria. So it also, I have a friend of mine that's been testing this for me recently. He's a big, he used to be in CrossFit a lot, but now he does a lot of performance with athletes, and he reaches his anaerobic threshold much later if he has methylene blue on board. So we're actually combining this, of course. We're using methylene blue with hyperbaric therapy, as you can imagine, and then seeing how these can benefit in the training period. So you can use those together, methylene blue and hyperbaric therapy, and then go train, because you have that extra capacity. So you're going to train farther, faster, for longer, and stronger as a result of that. So anyway, lots of different ways you can use it.
And what's the dosage when it comes to let's say, performance enhancement of methylene blue?
So the performance enhancing, depending on the type of performance. If it's like severe stress on the system, like the marathoner guy, like the ultra marathon, then we're talking about, I'm using 25 to 50 milligrams of methylene blue every 4 hours or so. But if it's a more like lower stress, I would say, then somewhere between 8 to 25 milligrams is kind of my dose for most people. I have them start off at the lower dose and see how they feel. But I have a lot of patients and a lot of friends and colleagues that are on 8 milligrams, 3 times a week just for performance gains when they're doing training.
And what would the timeline look like? Let's say, we know everyone has mitochondrial dysfunction. So let's say you want to take, methylene blue, you can do it in the troches like you have.
Yeah.
How long and at what dose would you say people should start with this?
It depends on what their goals are, but if it's more for like a performance enhancing kind of feel, then what I have people do is titrate their dose. So starting off at maybe 4 milligrams and then increasing their dose every 3 to 5 days while they're training, or try at a particular dose when they're training, say at 4 milligrams, and see how they feel. Look at their various metrics that they're checking, and then try it at 8 milligrams and see how they feel, and then try it at 16.
What about just for like generally like people that are unwell, which is most people?
Yeah, so that's when
They're
the titration.
not even focusing on performance.
Totally
right
understand.
now.
So, and that's most of the people that I work with, obviously.
Yeah.
Most people that I work with are chronically inflamed. They have antioxidant deficiency. They have energy capacity problems, so they can't make good amounts of energy. Some part of the mitochondria aren't working very well. The cool thing is that there's multiple parts of the mitochondria that make energy, right? And what methylene blue can actually do is compensate for any of those areas that the energy capacity may be deficient in. So they're called complexes. There's 4 complexes on the mitochondria, complex 1, 2, 3, and 4. So methylene blue can compensate for deficiencies in any of those complexes actually. And so, but the key is when you're starting somebody on methylene blue is that you want to start off low and go slow typically. So I'll typically start them off on 4 milligrams, which is just a quarter of one of our troches of the just blue. And then I'll increase the dose every 3 to 5 days until they start seeing a response. Now, what that response is will depend on whether we continue to titrate or we stay where they are. And then whenever they find that dose that seems to be working for them, I often say to people that if they've taken methylene blue and they haven't felt anything, it probably means that they didn't get to a high enough dose to see the actual effect. And so that might be 4 milligrams for some people. It might be 16 or 25 milligrams or 50 milligrams for other people, depending on how severe their mitochondrial stress is or what kind of support that they need. But the key for people that are sicker, that have more chronic inflammation, your fibromyalgia, chronic fatigue, long COVID, autoimmune problems, brain fog, exercise-induced fatigue, these are all mitochondrial issues, right? So we know that, well, we talked about the ovaries having a lot of mitochondria, but of course the brain has shit tons of mitochondria as well. So your brain, your heart, your skeletal muscle, and so this is where your symptoms of mitochondrial dysfunction are really going to be most profound. And so depending on where your symptoms are most profound, that's where we're looking the symptoms to be most impacted taking methylene blue. So if you're taking 4 milligrams and all of a sudden your brain's on fire, you're feeling great and that's your dose, fantastic. But sometimes it's, I didn't feel much, or maybe I felt a little bit, but not a lot. Then increase it in about 3 to 5 days to the 8 milligram dose. Then do I feel a little bit better? Do I not? Right? And then go to 12 and then go to 16. And then typically within that dosing range is when somebody starts feeling better, but sometimes we have to go higher than that. And once they start feeling better, then it depends on what the symptoms were or that they were addressing. But oftentimes keeping them on it regularly for at least a period of 4 to 6 weeks is what I would recommend for most people. Again, provided they don't have any other reasons, and they should talk to their medical doctor about any other issues, of course. And we can talk about some of the reasons why you don't want to take methylene blue or be more cautious. But in general, you want to be on it for about 4 to 6 weeks before you start trying to titrate that down, either the frequency or the milligram dosage that you're taking. Because I try to keep people on about 4 to 6 weeks, and then I start titrating their dose down to see kind of where they can be able to. Maybe they don't need to be on 5 days a week or 7 days a week anymore. Maybe they can be on 3 days a week, just on their more stressful days and things like that. But the goal for me always with this stuff, Kayla, is to get them off something like methylene blue. And really, as I'm putting them on or using methylene blue, I'm trying to optimize their metabolic function. So their vitamins, their minerals, their nutrients, their gut, their diet, their lifestyle, blah, blah, right? So that hopefully you can sort of peel off the methylene blue and then they're good because they've already been supported otherwise, right? So that's the goal in the end, but that does take time.
Yeah, and who would want to be more cautious with the methylene blue?
So if you are pregnant or breastfeeding, even though we have some really good anecdotal data that it can help with fertility, if you're pregnant or breastfeeding, you should stop methylene blue. The research, actually, the studies are actually pretty poor that there's actually any detrimental effect. But even though that's the case, what I mean by that is that the studies that were performed on showing methylene blue was detrimental to pregnant women or nursing women were very poorly designed and very poor. But even that's the case, we have to just be very careful in general and say that if you're pregnant or nursing, you shouldn't take methylene blue most likely, unless your doctor says otherwise. And then if you are on drugs that increase serotonin, so your antidepressants or your SSRIs or your SNRIs, there can be a small interaction because methylene blue also increases the amount of serotonin, dopamine, and norepinephrine in your brain for a little while. And as a result of that, the combination can be slightly uncomfortable for some people. So the best way to describe it is that people feel a little funny. This is even people that are not on SSRIs or SNRIs. When you're first taking methylene blue, it's not uncommon to feel a little funny when you first start taking it because it's giving you this neurotransmitter upregulation a little bit. So you feel a little bit different. Like usually it's a mood elevation. Usually people have a little more energy, a little more focus. It's all good. But if you're already taking some SSRIs or SNRIs, I always recommend that you're working with a provider very closely if you're going to do this. The risk is pretty low. The technical risk, if you're taking IV methylene blue and you're on an SSRI, that could be dangerous because IV gets to your brain much faster. Typically IV doses are higher, and that could give you a risk of something called serotonin syndrome, which is very, very rare, but it could be deadly. So you don't want to do that. So if you are going to be using methylene blue and you're on an antidepressant, I definitely recommend you work with a provider to kind of work on the titration game. But again, it's still a titration game, starting off very low, 4 milligrams, and just slowly increasing the dose just to make sure you tolerate it. But sometimes people that are taking methylene blue will also get some mild headaches or some mild detox kinds of symptoms as they're taking it. This is common, for everybody, right? Because as you're kind of revving up the system, you're detoxifying a little bit, you're making more energy, you might feel that you have like a little bit of those kinds of symptoms. They're typically pretty mild overall, especially if you start off at low dose. But if you start off at too high a dose too quickly, then it can get kind of nasty. And I've had a lot of people come up to me over the years and say, I started off at 50 or 100 milligrams of methylene blue and I felt terrible. I'm like, well, obviously, right? Because you had a lot going on and you didn't, and the people that were providing it to you didn't really realize that that's a great dose if you have an acute issue or if you have an acute infection. I have all of my patients keep a higher dose, higher strength methylene blue in their medicine cabinet, just in case they have an acute infection, acute trauma, acute ischemic episode even. Doesn't, again, relegate you from not going to the hospital. Please go to the hospital. But methylene blue can be, like, it's been studied in traumatic brain injury. It's been studied in stroke. And so I have all my patients, even my mom has it in her medicine cabinet. She had a tick bite a couple months ago, and I gave her 150 milligrams of methylene blue, along with the other stuff that she did too. But and my father broke some of his ribs. He was on 50 milligrams of methylene blue, along with getting in the hyperbaric chamber and doing exosomes and red lights and everything else. My dad's a chiropractor and crazy too. But anyway, the key is that when you're using methylene blue and you're thinking about side effects, if you go slowly with your dosing, it should be very, very minimal, unless you have to go to a higher dose because you have an acute issue. I find that people tolerate much higher doses if they have more of an acute issue overall, just because the body needs more of it to kind of to get the benefit overall, if that makes sense.
Yeah. So if I'm going to do methylene blue, should I do it before hyperbaric and combine those two?
So yeah.
Well, obviously you can do whenever, but ideally if I'm going to be doing hyperbaric that day also, when should I take it?
So what I would say is this: for low doses, like 4-8 milligrams, you can use it before, because what it's going to do is it's going to help rev up your capacity to make energy, and it's also going to do a much better job helping you with the detoxification process after making the energy overall. Okay. When it, however, in people that are kind of like elite athletes that are looking to make huge gains, I have them not do that right away. I have them use the methylene blue later on in the day, more as like a supportive, as like a low dose antioxidant in general, energy support. But overall, I use it especially in people that have more chronic inflammatory kinds of things with mitochondrial dysfunction. Using that as a low doses before hyperbaric therapy. And that's been transformative. And the other thing you can do, which I think you know this, is that you can also use red light therapy, because red light therapy, or near infrared specifically, 680 nanometers, has been shown to be synergistically powerful with methylene blue. So they both work on a very similar part of the mitochondria. So you get a synergistic effect. So I'll have people take their methylene blue troches, 30 to 45 minutes later, go in front of the red light panel, and then do their red light therapy, and then directly go into the hyperbaric chamber afterwards.
Love it.
Then you can go into your cold plunge afterwards if you want some energy, or you can go and do your sauna if you want to relax. But
Can you do methylene blue like in evening hours, or do you feel like it's going to be too stimulating or not? Really?
Yeah, so some people can take it at night, but some people can't because it's too stimulating. Now, it's not like a nootropic in the sense it's not going to make you feel wired. It shouldn't. Some people, actually, there's a small number of people that will feel that way with methylene blue. But in general, it's more of like, you just feel more elevated. You just feel like you have more energy, that you have more endurance. You look back at the rest of your day, like the day that you just had, like, wow, I had more energy. I didn't feel tired when I usually feel tired after I eat or after I need like a nap in the middle of the day, something, but you don't typically feel that way with it. So, but some people, like I can swallow it before bed and I'm fine, but other people can't and they have to take it in the morning. So typically the dosing is going to be somewhere like 8 o'clock in the morning. And some people take it twice a day. Actually, you can take it 8 a.m. and about 2 p.m. in the afternoon. Typically works pretty well for some people too. Yeah, it depends on what they're using it for.
Well, I love that. I mean, yeah, no, I love what you're doing with, your company and making methylene blue accessible.
Yeah.
Because it's not necessarily something you just find.
You have to be careful what you find out there too, right? Because a lot of the purity out there is suspect. So I'm sure you're similar to me, and I never recommend anybody buy anything from Amazon that's a supplement.
Definitely
like you can buy electronics, you can buy movies, whatever you want, but supplements have been over the years just so terribly, it's unfortunate. Like I heard one company that had all this counterfeit of their product on there, thousands of dollars worth that people were selling from the warehouse. And so you just don't know what you're getting on Amazon, right? But even with methylene blue, it can be contaminated with heavy metals. It can be contaminated with lead, mercury, arsenic, and cadmium. So you don't want any of those things, right? Especially if you're trying to get pregnant, or especially if you're, anybody doesn't want those things. Yeah. So you want to make sure you're getting from a good source. And when we first launched the company, it took us an extra 1.5 years to launch because we needed to find a good source. It took us that long. And we've had to throw out thousands of dollars worth of product over the years, that raw material that we've gotten over the years because it didn't meet our spec. And so there's very few other companies. I mean, like, I'm a physician, there's 4 docs on my team, including me. And so when we developed Transcriptions as a company, it was as a company to help people right now while they're on that longer path to optimizing their health, and certainly giving them lead, cadmium, mercury, and arsenic wasn't going to help them. But we loved methylene blue because it was so fantastically supportive and it could help people along that path. And then of course we launched in 2020, and then COVID happened, and then it was just, we had so much crazy stuff happening, but it was the timing was good because more research was coming out on the benefits of methylene blue for viral infections, especially at these higher doses combined with higher strength near infrared light as well. So it's been a journey, but for the most part, I use it for more chronic mitochondrial dysfunction in combination with the foundational framework that I use called health optimization medicine, along with, of course, using hyperbaric therapy as my fantastical and magical tool to help people optimize faster too. So.
No, I mean, I love it all. And this has been a great conversation.
Yeah.
I'm going to put all of your info, OneBase info, Transcriptions, all the info in the show notes. But thank you so much for joining me today.
It's been a pleasure to have an in-person podcast, Kayla, and just to be able to talk. Thank you so much for having me. And if people are interested, they can go to transcriptions.com. It's the website where we have all the products. The one we've been talking about a lot, just to kind of be clear, is called Just Blue. That's our pure methylene blue, 16 milligram strength. We have other products out there too that people might be interested in, a combination of methylene blue with something called nicotine. People have heard of that. I'm sure caffeine and methylene blue is with CBD, which is called blue cannatine. So people can check it out, but this has been a lot of fun. So thank you.
Absolutely. It's been a pleasure.
This podcast is for informational purposes only, and views expressed on this podcast are not medical advice. This podcast, including Kayla Barnes, does not accept responsibility for any possible adverse effects from the use of the information contained herein. Opinions of their guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical issue, consult a licensed physician.